health services, that's GPs and hospitals and anything that falls under the guise of a statutory service, doesn't make that much of a difference to your health compared to lots of other things. Just pause there. So health services don't make that much of an impact on your health and well-being compared to lots of other things. So you might be wondering, well, what are these other things? And so I will list a few. Good, clean air, nutritious food, access to parks and green spaces, your income, your employment, freedom from poverty. These are just some of the things. There's a really long list. And in the world of research, academia, and policy, we call these things social determinants of health. I forgot to mention housing. Housing is a key one. We call these social determinants of health. That should be fairly easy to remember because these are social things which determine your health. They're not within the gift of the health service. They're out there with lots of other services. They're out there with what you do with your life. Research by the institute where I'm employed by, Bradford Institute for Health Research. You might have heard of a study called Born in Bradford. And we follow lots and lots of families for a long time. And the idea is that you would follow these families to get an understanding of who is doing well, in other words, who is thriving as far as health and well-being is concerned, and who's not. Where are some of the problems? What we found is that children who are born in areas where there is high levels of air pollution, in particular car air pollution, vehicle-related air pollution, children are born much smaller in weight, and they're also born with a smaller head circumference. Now, you might be wondering, well, what's weight a determinant of? Well, an earlier research study from the 1950s had found children that are born low birth weight tend to have health complications much later in life, as in their 30s and 40s. So air quality is a massive determinant of your health and well-being. That's just one example. We're here in Heaton today, very close to Manningham. And about 10 miles north of here, we would end up, if we went there, we would end up in a place called Burley in Wharfdale. Now, it's about 9.1 miles, so just call it 10 miles, roughly speaking. If you caught a bus from Burley in Wharfdale and got down to here, towards Manningham, for every mile that you would travel, you would lose 1 year of life expectancy. So you'd lose 10 years of life expectancy compared to Burley in Wharfdale, compared to here. And in the last 20 years of your life, you would experience many more health complications compared to people living in the affluent areas. Those differences cannot simply be explained by health service provision. It must be other things, and those other things are air quality, are education, are income, are all things that we call health inequalities. Now, you might already know this, and if you did, great. If you don't, this is really important because it makes a massive difference to our health. One of the things that I'm most interested in from a point of view of health inequalities is something called social capital and community connectedness. It's something that I've been fascinated by, and to understand what kind of difference does it make to our health and well-being. Right at the beginning of this century, a political scientist, Professor Robert Putnam, published this fascinating book. It's not written purely for academics, it's for anybody who's interested in this subject of social capital. And it's a massive piece of research which is looking at lots of research across the US to understand what kind of impact does social capital have on our life. Social capital is all about how connected you are to the place where you live, how connected you are to your neighbours, what kind of role you play in your society, volunteering, social clubs, community groups. All of those things were looked at. What Robert Putnam found, and he documents in massive detail, is that being connected to your community, to your neighbours, to people who are like you, wherever you might live, has a massive impact on your health and well-being. And the most important quote from all of this book that stands out for me, I should say, is there's a whole section after describing all this where he says, joining a community group can be as good for your health and well-being as giving up smoking or joining a gym. So Robert Putnam's work demonstrates that actually even simple things like joining a community group and taking part in local neighbourhood activities has a massive impact on your health and well-being. Is this knowledge new? From a political scientist to an anthropologist. This is Margaret Mead. In one of her lectures, a student asked a very interesting question. And the question was, what was or when was the start of human civilization? Now, most people who were present were thinking the answer would be something along the lines of fish hooks or clay pots or art in caves or other kinds of tools, paraphernalia, the kinds of things that you would associate with artifacts. That was the beginning of human civilization. But no, Margaret Mead didn't answer with any of those things. Her answer was very left of field and very interesting. It was a broken femur, this was her answer, it was a broken femur which had healed. So just some context. The femur is the longest bone in the human body. It connects the hip to the knee. And the context about why this was the start of the human civilization, the context is that it was a broken femur that had healed. Now in the animal kingdom, if the femur was broken, that would mean life is over, game over, because you wouldn't be able to escape from predators, you wouldn't be able to go and find food, you wouldn't be able to go find water, you wouldn't be able to go to your shelter, you'd always be in danger. Even with the advent of modern medicine, it takes at least 6 weeks to heal. So we're thinking about a very long time ago, a broken femur, fossilized, was found, which had healed. That instantly told the anthropologists and Margaret Mead's team, that this person was cared for by a group of people. It didn't just heal, it was somebody who'd taken care of this person, protected them, given them shelter, given them food, given them water, pretty much looked after them until they were healed. And that was the very first sign of human civilization. Looking out for your neighbours, getting connected through groups, allotment societies, gardening groups, cycling groups, walking groups, all of the kinds of things make a big difference, which is why it's so pleasing to see all of these things now appear as social prescribing in the National Health Service. So that's really positive. But if we go back to Bowling Alone, Robert Putnam, the political scientist, the reason why the book's name is Bowling Alone is because he documents that all of these things that make us a good human civilized society are fraying. They're breaking away. So much so that people who used to go bowling together in groups are now going bowling alone. And he documents lots of reasons why this fraying and decaying of community connectedness and social capital is happening. Things like the introduction of the car. When you get into a car, the chances of you meeting others, your neighbours, your people who might in the future be your friends, reduces quite significantly. So he documented how the introduction of the car reduced human social capital. He also mentions how TVs had the same effect, because previously we would go and connect with people and meet them and enjoy life together. Now you could sort of isolate yourself and shut the door and switch the television on, and it reduces your chances of building on social capital. So he talks about lots of things in lots of interesting ways. Why is this important now? It's important for lots of reasons, because the Royal Society of Arts has just published an article where they have documented that the average Brit in the UK now spends 18 hours and 43 minutes on average at home. So we're becoming a very homebound society. Also, in the same article, a decade ago, the average person had about 5 friends. That's reduced now to 3 friends. So we are slowly disappearing into this world of social connectedness and social capital, losing the value it has always served us. And it's an important thing that we've got to take account of, because the World Health Organization, which is an authority that we should bow down to and respect, because they do really pull together some very important information, have found it so concerning that they've organised a new commission on social connection because they see this as a global priority. In an age of growing division, we cannot deny that. In an age of growing division, it's more and more important that we start using this toolkit of social capital and community connectedness, because it's not only good for society, it's also good for our health. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Thank you.